excited. I'm like, is force the vote still alive? If New York City was to get their own universal health care, how come more states haven't got universal health care? Universal Medicare for all. We're going to just wait for the U.S. to finally fucking pick up. I mean, why wouldn't the states pick up and... So anyways, Maya Wiley, I was wondering, holy shit, force the vote could still happen, because if New York City gets universal health care, then that is one step closer for the rest of the United States to get universal health care. So let's take a look at Maya Wiley's administration. This is what she's saying about universal. This is her universal health coverage plan. She's going to offer affordable health insurance, regardless of income or immigration status, to meet the immediate needs of uninsured New Yorkers. Enroll more people in a government-sponsored plan, moving us closer to realizing health care as a right. So that's the direction. She's going in the right direction. But is that the end goal? Is it the end goal? A single payer, get everybody covered? It says offer affordable health care, enroll more people, moving us closer. Repurpose federal, state, city, and private funding currently used to pay for the health cost of undocumented and uninsured New Yorkers. Establish affordable sliding scale premiums to ensure access to all New Yorkers regardless of income, so that no one ever pays more than 10% of their income on health insurance, and insurance for folks making less than $25,000 per year paid nothing. To ensure transparent and efficient administration, the Maya Wiley administration, they're going to assign management of the universal health care plan to an affiliated nonprofit, ensure managers contract with proven insurers committed to providing affordable health care, establish a governing board for the plan made up of subscribers to the insurance. Why? We're still sticking with insurance, right? Just have a fucking plan. If you're in New York, go to the hospital and they'll take care of you. That's exactly how it should be run. 8.5 million people. New York has to run, it's 8.5. They got to do their shit differently than everybody else in the entire world. It's a lot of motherfuckers just be piled on top of one another. 8.5 million people. So, establish a governing board for the plan made up of subscribers to the insurance plan, health professionals, insurance advocates. Of course, the insurance advocates. Don't forget the insurance advocates, union leaders, business organizations. Separate administration of the plan from city officials to encourage greater participation from undocumented New Yorkers wary of participating in publicly run programs. Force the vote. I wish it was more universal health care. I wish it was all about just, let's get this covered, let's get this shit done. But instead it's kind of saying, keep the private, do a little bit more public, kind of, inch our way. Let's increment, let's just progress incrementally. So this is not a force the vote moment. Not yet.